Good morning, everyone. Welcome to the public session of today's Oversight and Engagement Board for the 21st of January. It is 10:07. Apologies for the slight late start. We had a very good discussion in the private meeting, which overran slightly. So we are here now, but we are live. So if anyone has any questions, if they could please use the hands up facility, that would be great. So moving swiftly on, we'll go to the minutes from the previous public session for the 7th of January. I'll assume everyone's okay with the minutes and we'll sign them off unless anyone has anything to say about those. I'll look around the room just in case. No, okay, we'll sign those off as an accurate record of the last meeting. Perfect. So we come straight to the next item, which is the weekly surveillance report, and we go to Lucy Whiteman, our Director of Public Health. Lucy.
Thank you and good morning, everybody. So we're just going to share with you the surveillance report from last Friday. So this contains data up to the 10th of January 2021. A number of headlines that we've pulled out of the report, as people will see. So obviously everybody is aware that we are still in a national lockdown. So that obviously means that we should be staying at home to protect ourselves, each other and our NHS services, amongst other things. And that is because we've got this mutant, more transmissible strain of coronavirus, and it's caused a sharp increase in cases across the country, and that has been acutely apparent in Corby, Northampton and some of our other boroughs and districts, Northamptonshire itself having a significant increase in the last 2 weeks. So clinically vulnerable adults who shielded in the first lockdown are being urged to do so again because of the higher level of transmissibility with the new strain. And that obviously in Northamptonshire is a risk, and that's translated into 4,604 cases of coronavirus in just the 7 days up to the 10th of January. So you can see it's still very live issue locally, and that this new strain is very rife. So mixing between households, despite all of these national lockdown rules, is still the greatest cause of transmission locally. And that's both between household members. So when one member becomes COVID positive or develops symptoms, them not isolating themselves away from the rest of their family members as much as is possible. But also we are still getting reports of people mixing between households, despite that actually currently being outside the law. Because we're seeing these high numbers still, and particularly in the over 60s, we are still seeing significant numbers of people presenting to A&E, being admitted, and sadly a high number of deaths in the over 60s primarily. But I don't want people to feel that they're immune if they're younger. We are also seeing, because of the sheer numbers at the moment, a significant number of people in their 20s, 30s and 40s who are being hospitalised with this current strain. So we cannot afford to be complacent. So we've got the normal couple of pages at the front with some information and background. If we go to the first data page, please, Cheryl. So this, I think, obviously paints a very stark picture. So, you know, we were talking before Christmas in late October, early November, about having concerns of 1,000 cases in a week. At the moment, as we've just mentioned, there's over 4,500 cases in a week, and that has not significantly dropped since last week, despite the fact that we are in a national lockdown. Now, indeed, that will be in part due to the fact that this new strain is so transmissible that it is, for every person who is infected, there is a much higher likelihood that they will go on and infect other people, which is why self-isolation is just so important at the moment. But it will also be because we have not seen the high levels of compliance that we saw in the first lockdown. And again, we would urge people to recognise the risk that they pose to themselves and others if they do not adhere to the current lockdown restrictions. If we go on to the next slide, please. So here you can see we've had a small reduction. We are talking about, you know, a handful of cases from point of view of the downward arrows in boroughs and districts as compared to the previous 7 days. But the overall trend in Northamptonshire is still not, you know, in a position where we would be happy or in a position where we feel we could take the foot off the pedal. In fact, we've still got Corby, Kettering, Northampton and Wellingborough with increasing case numbers. If we look at the next slide. As we compare trends, so this is a rate across different boroughs and districts. We've still got alarmingly high rates. If you look at Corby at 929 cases per 100,000 population as a rolling 7-day average. Similarly, Northampton at 876.2. These are, scary rates that are very, very reminiscent of those that we're seeing in southeastern London. Yes, absolutely attributable in part to the new variant, but this obviously as well is a demonstration of the fact we've got highly populous areas and people who are simply not isolating themselves. If they have any concerns, develop any symptoms, they should be isolating and getting a test. If we move on to the next slide. So from a point of view of deaths, as I said, because of the sheer numbers that we're seeing infected, we've seen a very sad rise in our case deaths as well. Again, each borough and district affected, nobody is immune here. High numbers in areas that you wouldn't necessarily anticipate. So Wellingborough, you can see into double figures there, as well as Northampton. But it is an increase on the last week's number of deaths, and that obviously is something that we must desperately try to avoid. If we move forward. So overall, this is just the illustration of the case rate trends. So yes, we are starting to see a tiny downward trend in some areas, but when you compare it to the very sharp and significant increase towards the end of December and into the beginning of January, we have got a long way to go before some of our boroughs and districts are even down to the England average, let alone below it, which is obviously where we would want to be. So if people are looking forward to having a spring and summer where they have got some of their freedoms back, then we have got to be adhering to the rules. The sooner we do the right thing now, the sooner we can get back to the freedoms and a summer that we would be able to go out and enjoy. So a little bit of short-term pain is worth that long-term gain to protect ourselves and each other. If we move forward again. So you can see we're still very much struggling with case rates in our working age population. We are really concerned still about the high numbers of cases in 17 to 21-year-olds, but the lion's share of cases in Northamptonshire, again, is still in our 20 to 29 and 30 to 39-year-olds. These are more socially mobile people. They tend to socialise more and obviously are very much working age adults who may be in lower income type groups and therefore may still be required to be working, so furlough may not be available to them. Now, we recognise people do have to work. We recognise how hard our businesses are working at ensuring that they are providing COVID secure premises, but we know that things like car sharing, socialising sort of during lunch breaks, at cigarette breaks, various other points during the day are the points at which this transmission is happening, not really within the workplace setting, but in the sort of social hours and periods around and in between. So please, please, please don't let your guard down. Don't leave COVID secure at the door. You have got to be maintaining best practice throughout the period that you are outside of your workplace as well, please. If we move down. So this is our over 60s, and again, you can see why I'm concerned. We've got still significant and steep increases in particular boroughs and districts for our most vulnerable residents, and all of our areas here are still on an upward trend. You know, we've only got one area, East Northants, which is really plateauing. So despite some of our areas looking better from an all-age case rate, we're still seeing our most vulnerable at risk. So we really do need to make sure that we are protecting wherever possible. If people have childcare responsibilities, making sure that you do that as safely as possible, wearing a mask, maintaining social distancing where that is possible, and indeed frequent hand washing of both the people you're caring for and yourself. So if we go on to the next slide. And this is why those over 60s, as I said, translating into a high number of beds occupied in the hospitals. You can see that latest data there up to the 12th of January showed that there were 418 beds that were occupied across our 2 hospital sites by COVID positive patients. Now, that poses a challenge not only from a point of view of managing their care, but also managing business as usual care. A lot of our areas of hospitals, in the hospitals, are obviously now what are called red zones, so areas that only COVID positive patients can go into. That does deplete the overall bed base because of the requirement to distance those that are positive from others, and it is putting pressure on our staff, not only because of just the, the sheer numbers of very ill people that they're having to look after, but also because our staff are at risk of catching COVID and obviously having to self-isolate if they're exposed. So it is still a very challenged picture, not just in our acutes, but also in primary care, community care and adult social care too. If we move on. So we've always provided the areas that are most affected, both from point of view of accrued cases, but if we go down, obviously as a case rate and also the percentage change. So that's those next two maps as well. And if we go on to the slide after the maps. So people will see summary of outbreaks. We provide this obviously every week again, and I'm sure people will notice that again, there's been a sharp increase in the number of outbreaks locally, primarily those in care homes and care settings. As we know, they are being routinely swabbed, but just the sheer infectivity of this new virus is causing us problems, and we're seeing high numbers of people affected when an outbreak does occur in those settings now. So obviously we're trying to work with infection prevention and control teams, with environmental health officers and with the providers themselves who are working really, really hard to maintain COVID secure environments. These are primarily asymptomatic cases that are being found, but we are still finding symptomatic cases. And as I said, the risk of transmission is so much greater because of this new virus strain. So people need to be alert. If we go on to the next slide. The one good news story, again, obviously alongside the COVID vaccination rollout, is the fact that flu continues to be rolled out, and we are improving our uptake as compared to last year in all of our key groups. So again, good news, and I would just reinforce the fact that you can still have your flu vaccination as long as there is a 7-day gap between that and your COVID vaccination. So please, if you haven't had your flu vaccination and you are called, don't worry, we can work your COVID vaccination around that. It will not stop you getting both. So please do take up that invitation if you receive it. Flu vaccination season goes all the way through to March. We want to get as many people protected from any kind of respiratory virus this year. So please, please, please take up that invitation if it arrives. In the next slide. So obviously just a reminder of all of the work that we're doing, the fact that we are currently in a tier 4 area, that we must be obviously complying with all of those restrictions if we are to indeed get to a point where we can start to come out of a national or a local lockdown position. So please, working together, making sure that private dwellings are seen as just as high risk as other settings, and that people are taking every measure that they can possibly to stop onward transmission. Thank you.
Thank you very much, Lucy. Some sobering stats in there, as always. I'm going to see if there's any questions. I don't see any questions. Did you want to come on to testing update? It may be that Toby Sanders might want to come in and just give us a very brief overview on vaccination before we go to that. I know there's a limited information in the public arena, but I think it would be useful if Toby gave us a quick update as to what he can say here in this public forum about vaccination. Toby, I'll come back to you, Lucy, on the testing update, if I may. Toby.
Okay, thank you, Councillor Morris, and yeah, very happy to share what I am in a position to share this morning in terms of vaccination rollout across Northamptonshire. Again, and Lucy referenced this in her previous piece, a really positive position in terms of where we are in rolling this out across the county. We all know that this is the way through this for us, not just locally, but nationally and internationally, frankly. And as I've briefed this meeting on previous weeks, we've made a really great strong start to this. We started vaccinating in Northamptonshire back before Christmas at the beginning of December. We now have 16 of our GP-led primary care network sites delivering the vaccines to our local population across the county. We also have 2 hospital hubs, one at Northampton General and one at Kettering, both of which are providing particularly vaccination to health and care staff, not just hospital staff, but staff across the system, whether that's the community trust, mental health colleagues, people in social care, and other provider staff. So we've got those kind of delivery routes up and running, as well as our care home service, which is now reaching out to care homes on a mobile basis, and also our home visiting service as well. And I know, Chair, that we've got Julie Shepherd on today's call from NHFT, whose community teams are playing a really big part in that care home and home visiting kind of rollout part of this. What I can share, because I'm keen just to put a few numbers into the public domain here, if that's okay with you, Chair. I think it's important for people to be able to get the sense of progress we're making with this and the speed at which this is rolling out. As of close of play Tuesday this week across Northamptonshire, we have vaccinated and delivered vaccines to over 55,000 people. That is a huge number in such a short period of time, and it's a great testimony to the massive hard work from all of our staff in general practice, in the community trust, in the acute trust colleagues and local colleagues in local authorities as well, working on this. We are, of course, working in line with the national guidance around the priority cohorts to be vaccinated first. So our initial focus has been very much on over 80s, people within our communities. And again, I'm pleased to be able to share today that we're making really strong progress there. We have now already first dose vaccinated over 3/4 of our over 80s population. And we've also made significant progress in terms of vaccinating residents in care homes through the roving model that I've described that's out and about across the county, reaching out into those different settings. As a result of all of that, we are now starting to work down the cohorts as well. So there will be residents in our county in 75 to 79-year-old age groups who are being contacted by their practices and by the national programme and being invited in where it is appropriate. I really would, a kind of key public message for me would be to reiterate the message we've delivered consistently through this, which is please wait to be contacted by the NHS for your vaccine. We will be in touch. We are working through those priority cohorts. Some of those cohorts will be addressed at different speeds in different parts of the county, just as a result of when some of our GP sites went live. So I'm well aware that there'll be some residents in villages who will have a neighbour or a friend or a relative who might have had an invite and they're still waiting for theirs. We will get to you and we will work through that in that priority order. So please do be assured that we have the capacity locally to be able to deliver this rollout. Our rate limiting factor, Chair, as with national position is very much vaccine supply. We've got the ability to deliver pretty much whatever comes through to us, and therefore we're working really closely with regional and national bodies to make sure that we're doing everything we can to get as much vaccine supply into the county so that we can carry on rolling this out as rapidly as possible. I'll pause there for today. I don't know if Julie might want to give perhaps an insight or a perspective into kind of what life feels like from one of our provider trusts whose staff are both working to roll this out, but also are being vaccinated themselves as well.
Julie.
Thank you, Toby. I think you've given quite an extensive update there. Really not much extra to add. We are, as you say, involved in a lot of the rollout programmes as a community mental health trust. Our staff obviously are not only involved in delivering the COVID vaccines, but also delivering and providing care. So in the NHS, it is, as you know, very pressured. Our staff are working long hours and very dedicated to what they're doing. And I thank all our NHS members of staff in the county. They're doing an amazing job, and I think that's all I'd like to add.
Thank you very much, Julie. And we would, of course, add to that our thanks to all the people who work very hard in the NHS and to you, Toby, for that update. We hope to have, a more widely available figures at some point that we can share. But there are restrictions on what we're allowed to share. But what we can say is that we're doing a very good job in this county of the vaccination programme, and we can be very proud of the response that we've come to so far, and how it will roll out further will be very impressive, I think. So we'll thank you, Toby. Thank you very much for that. I'll come back now to I did have one question actually. Councillor Phil Bignell had a question. Phil.
Yes, thanks, Ian. Sorry, I had to leave the earlier meeting, so I may have missed the answer to this question. It's about compliance, and it's about leaflet delivery for election purposes, particularly by the Liberal Democrats, which they appear to be doing and claiming it's under some volunteering type of thing. I mean, it's a bit like our policeman saying about loopholes and things. I mean, what's the official position? I mean, I believed you couldn't do it, but they seem to be circumventing this. Could I have an official answer on this, please?
Thank you, Phil. Lucy, would you be the right person to answer that one? I think you probably would be, in as much as you can.
So Simon Blatchley and I have conversed on this, and we've provided some feedback already to another person who sent us in the same query, Councillor Bignell. So I'll forward that response on to you.
Thank you.
So, Chair, could we all have the response then, please? Because I think it'd be interesting to all of us.
Yes, we'll share it with the group.
Okay, thank you.
But just as a general rule of thumb, I would imagine that that's probably not something that should be encouraged at the moment, given the restrictions. But we'll wait to see what the information is in that general the letter that's gone out, or the information that's been sent around. So thank you for that. If I come back to you now, Lucy, for a testing update, it would be great to hear how well we're doing there, which I'm sure we're doing very well. Lucy.
Thank you. So yes, if I just give you a quick update. Overall Pcn testing, so that's the symptomatic testing where people book through the national system. We've got really good testing rates locally, and that's really positive. And again, it's one of the tools that we've talked about in our toolbox to overcome the virus. We need to make sure that people who are developing symptoms isolate as soon as they develop those symptoms, get that test booked. And Pcn is still gold standard from a point of view of getting a definitive negative or positive test result. So really, really clear that all of those resources are available. We've got our local testing sites still in Northampton, Kettering, Corby and Wellingborough. We've got our regional testing site in Kettering, and we've got 3 mobile testing units at the moment that are making their way around the county. So we've got one in Northampton, one in South North Hants, and one in Daventry at the moment, I think it is. And then we've got one moving to Corby from Monday. So trying to make sure that we've got good coverage of all of those areas. One of the new developments, so obviously we've talked about before, is lateral flow device testing. So this is for people who don't have symptoms. And we need to make sure that obviously we clear up a little bit of a myth here. Just because you don't have symptoms doesn't mean you don't have COVID, or that it's not proper COVID or real COVID. It is COVID. There is only one form, but it affects people differently. Some people have symptoms and obviously do end up being very unwell. Other people can have it and have no symptoms whatsoever. And it's those people actually that pose the biggest risk, because understandably they don't know they've got it. They will be going about their business as usual, and they will be potentially putting other people at risk. So this new asymptomatic testing, so testing for people without symptoms, is really, really key. We've got a couple of different programs. There are some national programs, and we've talked before about the fact that this is the type of test that NHS staff use and health and social care staff use in care homes. So we've also been having that rolled out nationally to prison staff, to university students, I'm sure people will have heard talk about before Christmas, and also to make sure that they're safe to return. And then also more recently, school staff and pupils in secondary school, and will be staff in primary school too. So lots of progress on that national front. Locally, however, we've been asked to facilitate community-based testing and workplace testing that sit outside of those national programmes. So we've been working with public sector organisations such as the police and our social workers and the fire service to roll out lateral flow device testing. And I'm pleased to say that the police have already gone live with that, fire are following shortly, and we're just developing a programme to support social workers as well. More importantly, we've got 2 lateral flow, so asymptomatic testing sites now open in the community. That is a bookable system, and you'll find the link to that on our website. And it just means that you can log on, even if you don't have symptoms, if you've got a concern, and particularly if you're a frontline or key worker, you can then book an appointment, go and have a test either at Corby or at Northampton, and then you can go and obviously get a result within 30 minutes. One of the really important factors is that if you test positive, obviously you must isolate, but you must also get first a confirmatory PCR test. So you are still required to have both if you are positive. If you are negative, however, that means that you obviously are safe to go and work or do what you were going to do that day, but you must still adhere to the hands, face, space rules. Obviously, it doesn't mean that you don't have COVID. It just means that you don't have a high viral load and you are not infectious that day. So it's not the same as PCR. It doesn't tell you you don't have COVID, but it is a really, really good risk reduction factor to highlight those that may pose a risk to other people. So good news that we've got 2 of those community testing sites up and running, primarily focused on key workers at this point in time. And over the next couple of weeks, we'll be able to give you more information about every borough and district having their own asymptomatic testing site.
Thank you very much, Lucy. Some really good progress there, and all part of our battle against the COVID the COVID thing, the COVID situation we find ourselves in across the county and in the country. So really good progress there. I'll bring you back in just to have a quick contact tracing update. Again, one of the many weapons we have in our arsenal against this disease. Lucy.
So contact tracing going really well. We've still got our local team that support the national team, so it's a partnership between the two. Really good follow-up rates. We do still have people who sadly do decline to obviously participate in that follow-up, and it is really key that we do identify anybody that a case may have been in contact with, because they are potentially at risk. And as we've talked about earlier today, we are seeing significant and severe disease in all sorts of age groups. So it is really important that information is shared only for the purposes that we let them know that they've been exposed and that they need obviously to be self-isolating as well. So really just part again of, as you say, another tool in our toolbox, progressing really well, very well supported by our customer service centre. And people are now also receiving texts when they're identified as needing to self-isolate, so that they've got all of the information they need to make sure that they get the support, financial and other, that they might need during that period, but also to make sure that people just have good news messages, that they get encouraged, and we're sending texts to encourage people and congratulate them on their self-isolation and reinforce the fact that, you know, they're doing their bit, they're helping protect other people who could be vulnerable, and you know, this is the way out of this mess, as you say.
Thank you very much, Lucy. So again, some great work going on in the county there on the contact tracing. I'm looking around the room for some questions. I don't see any for Lucy. So I'm going to bring in Claire Hughes for a comms update. Claire, good morning.
Good morning, everybody. Yes, so just to add to some of the things that have been talked about earlier, we're continuing to promote messages through the breadth of channels that we have. Particularly this week, we're launching a new radio campaign with the theme "Every Touch Could Leave a Trace." This will be running on local, commercial and community radio stations across the county for about the next 6 weeks. And in addition to that, that same theme is being extended to bus advertising, to the bus panels and bus stops across major towns across the county. And the reason for this is the campaign aims to remind people to keep washing and sanitising hands, because the virus obviously is transmitted easily on so many surfaces that we all don't even think that we're touching throughout the day. So if we are travelling to work using public transport, and we go on a bus, do we press the button on the bus, do we touch seats? So all of those things, those daily activities that we're doing, and in and out of the home, this is just to remind people that everything you touch is a possible chance where you might be transmitting or even catching COVID. So it's quite sort of, it covers the campaign theme covers sort of everyday activities where you might be going out shopping and also in your home. So that's a sort of something that we're really leading on at the moment. And that theme will continue through a lot of our messaging and our other channels. We're also trying to improve our engagement with the BAME communities and younger people. Some of this work means that we're focusing on translating specific messages to a range of those materials that we're using, and we're also reaching out through our focus groups and with others to reach community leaders and influencers, so that we can try and penetrate a little bit deeper into those audiences in the communities that are sometimes harder to reach. Hopefully people have seen the GOMO vans. We're continuing to use our bright messaging on the sides of GOMO vans and iWalkers. We've been locating them around shopping, and I say shopping sites, but basically where people go for their food shopping. And we've been able to get access to sort of fronts of supermarkets where we've got a lot of traffic flow of people going and doing their essential shopping. And that's again reinforcing the key messages: every touch may leave a trace of COVID, or you may contact that, and also all of the sort of things of hands, face and space. We've also introduced in the last week where we are sort of an intelligence-led location. The beauty of the GOMO vans is that we can move them as and when, and we can change the messaging very quickly. So we have our daily updates on where perhaps there's areas of non-compliance or we're seeing problems, and we've used a very quick and effective way to relocate those vans, and that happens on a daily intelligence basis. So we're moving them around the county. We're also continuing, we've also increased the number of geolocate advertising banners, so the number of impressions. That's basically the frequency with which We can reach people on little pop-up advertising through when people are using apps on their mobile phone. And we've particularly used this in postcodes to the south of the county where we haven't had outdoor advertising boards locations available. And again, continuing to use all our outdoor boards where possible in front of supermarkets and our public green spaces, because we do know that one of the reasons people can leave home is to get their daily exercise. So again, just trying to remind people in those key locations. All of this, we're continuing to try and find new ways to reach more people. Last week, we launched our new TikTok account in order to engage with a younger audience. That has been received quite well, but we will be looking to work with others to extend the reach of that account. We've also this week been working on creating a new podcast series, which will look at topical issues during COVID. And again, the reckoning and the reasoning behind that is more people are trying to have some me time. They may be putting their earbuds in when they go out to work, to walk, or on their way to work, and it just gives them some insights and an opportunity to give some more detailed messaging around some of the issues that we're dealing with. And then lastly, but not least, we're also trying to focus efforts on developing communications to support businesses, and that's around helping inform their employees about safe COVID behaviour, both in and outside of the workplace. We know that a lot of transmission is predominantly out of workplace. It's sort of where people are travelling to and from work, car sharing, using public transport, or even in household to household and in household. So reminding, again, a way to reach people by targeting employees and reminding them of those safe practices to avoid and minimise transmission. And then there's a lot of other things that we're continuing to do as well. The lateral flow testing for asymptomatic testing, which Lucy's talked about earlier. We've issued a press release on that this morning. Continuing to promote those few people that still haven't had their flu jab, looking to support people in their care homes to provide sort of good, safe COVID behaviour practices for care home staff, and just continue to trying to look at fresh ways to develop our messaging so that we know everyone's COVID tired, but just trying to keep that message landing with people. Thank you. Take any questions.
Thank you very much, Claire. And as always, thank you to you and your team. I do think the comms team have done a sterling job during this crisis and have reached probably a lot more people than we could have reached by any other method. So thank you from me, and I'm sure from everyone else on this meeting today. And you continue to innovate, which is always good to see. And you're trying to get ahead of the curve, certainly on the TikTok and things like that. So it's very good to see. And I'm sure you will continue to carry on the good work. So I'm looking around the room. I don't see any questions, in which case, Lucy, did you want to say anything before I close the meeting? No, excellent. Thank you very much. So I will close the meeting shortly. Our next meeting is the 4th of February, 2021. It's always good to give us the year, because sometimes I think people forget that it's 2021. I think we're all caught up in 2020 still half the time. So I remind you about that meeting. We do have the press conference tomorrow at 3 o'clock as well. And next Thursday, presumably or I think it's Thursday, will be the councillor briefing update as well. So I'll just remind you of that. I'd like to bring in Richard Auger just quickly there. He's just put his hand up. Richard.
Yeah, thank you, Chair. It's been nagging me ever since we had the answer from Lucy. Put away the party politics. Is the leafleting okay or not? I don't know why we're sending letters or is there some sensitivity in announcing it? If we know the answer, should we not? Because of course a lot of us will be up for election, and we probably want to know.
So an email has been sent around just confirming the position, but no, the police, in my view, is that it isn't in the spirit of the current lockdown legislation. It's not explicitly an exemption, but charitable reasons for leaving your home for sort of voluntary pursuits is more so from a point of view of providing support to the COVID outcomes and those that need support, as opposed to leafleting. So the police, in my view, is that although it's voluntary, activity, which technically is within the rule of the law, it certainly doesn't fit in with the spirit of the current lockdown requirements. So that's advice.
Thank you. I think that's important for us all to know, because a lot of us elected members would be wanting to know this situation. Thank you, Chair. Thank you, Lucy.
Thank you, Richard. Ian, your hand is up as well. Is it on that same point?
Yeah, thank you, Ian. It was just to say that I was the member for whom Lucy was referring to having correspondence, and I've now circulated it to everybody that I could find on Cheryl's email. So if she wants it circulated, I've done that myself. So we're busy enough doing things, so there's no need for anyone to worry about it. It should have been sent certainly to everybody on this call, and probably wider. It was 45 names I saw on the thing, so it's gone out.
Yes, certainly we weren't trying not to give the information here, but this meeting is largely apolitical, so we just have to be a bit careful not to stray into the world of politics, particularly as this is everyone, all members are welcome on this group, including our from other parties. So I just didn't want to stray too quickly into that, but we've now had the answer, so that's very clear. Thank you very much for that. So as I say, the future meeting for this group is the 4th of February. Thank you everyone for coming today. Thank you for the questions and answers and the presentations, as always, in the private and the public session. I look forward to seeing you all on the 4th, if not before. Stay safe and well, and let's follow the guidance, and together we can beat this virus. The best approach is to act as if you've got the virus, really, and that way you can stay safe and you can keep everyone around you safe. So I'll close the meeting. Thank you very much, and I'll speak to you all